everybody. It's great to be with you today during the global phenomenon that is JBI gLocal. I'm very proud to be here supporting colleagues from Wales in the Romanian JBI Centre for Nursing Research. And as I start this talk, I wanted to also particularly acknowledge the clinical partners that are so involved in promoting and implementing evidence-based practices, and in particular, the Fudini Clinical Institute and the Psychiatric Hospital, and the obstetrics and gynecology clinical hospitals as well, who are represented by colleagues and associates here today. And also to those from Wales, from the JBI Centre of Excellence. It's good to be with you. And of course, gLocal is about global evidence, local practice. And so to the nurses and midwives from Wales and Romania who are concerned with and invested in the quality of care that is so useful for future generations, as well as safety and quality of practice today. You have a superb and interesting program ahead of you, and I'm really pleased to have this opportunity to share in part of it with you. And I wanted to focus on what I originally titled a new dialogue. And then as I reflected on what is it really new, I changed it to a not so new dialogue for professional practice in 2024 and beyond. So why a dialogue? Well, conversations and the notion of words around conversations are deeply influential on not only scope of practice for nurses, midwives, and other health professionals, but also on the culture and shape of practice, as well as policy. So it's important and useful to look at what's going on in the professional dialogue. But to do that in a way that helps us point forwards, it's also useful to know where we've been. So looking backwards to look forwards, if you like. So in this presentation, we're going to look at two documents and their significance to nursing. The first is one that you might not be familiar with, but it's called the Sicily Statement, and it was published in January of 2005. And the second is a paper from the USA, published in May 2021, but it's about the future of nursing. And it's an interesting paper that covers the policy framework from 2020 to 2030. So we'll look at those to help us go forwards. But before we get too far into it, this is who I am. I'm Craig Lockwood. Some of you know me already. I'm the Program Director for Implementation in JBI, as well as Editor-in-Chief of our journal, JBI Evidence Implementation. I have no direct or indirect financial conflicts associated with today's presentation. And if you want to promote gLocal and help the world see your impact, then use hashtag JBI Solution Room and follow JBI EBHC on Twitter as well. So let's start by looking back at where we've been, where we've come from. You know, there are so many sayings about this: know where you've come from in order to know where you're going. Looking back to look forward, etc., etc. Over the next few slides, we're going to be looking back, in fact, to the year that YouTube was launched. Also, the year that Romania signed a treaty in preparation for joining the European Union. Do you know it? It's the year 2005. In 2005, medicine globally was actually struggling to define and get agreed consensus around what evidence-based practice was, and to understand some uniform characteristics of what should be the underlying processes for evidence-based practice. In fact, what is an evidence-based process versus an evidence-based outcome? But a group of people decided they needed to do something about it. And so you can see the graphic on screen is the Sicily Statement that was published in 2005 in BMC Medical Education. Deciding to do something about it was actually the key to this entire program of work, of course. And it's the first point I want to highlight. If you want to understand something, try to fix it, verify it, or define it. Get a group of people together. They don't all have to be Nobel laureates. Anna Aslans or Victor Babs, who are both famous Romanian health professionals who worked in sciences on patient outcomes. Not all of us, and especially me, could be of that fame or renown. But are we willing? if we're willing, it's feasible. So the rationale for the Sicily statement actually began in 1992, and it was published in 2005. So you can see the huge amount of consensus building that went on before they reached this point. But the rationale was for healthcare to be delivered in ignorance of available research misses important opportunities to benefit patients and can actually cause harm. Providing evidence-based care is a key skill, and it should be for all healthcare workers from diverse professions and cultures. And the ability to deliver evidence-based practices helps promote individualization of care and assures the quality of healthcare for patients today as well as for those of tomorrow. So you're probably wondering, well, what does this Sicily statement look like? It was informed by this simple statement: knowing is not enough, we must apply. Willing is not enough, we must do. And as I mentioned, it took from 1992 to 2005 for the aims of the Sicily statement to coalesce and to begin to develop into formative recommendations for what EBP actually consists of. So what their goals were to come up with a clear statement of evidence-based practice, a description of the minimum skill set required to practice in an evidence-based way, and a formative curriculum that outlined the minimum standards of and educational requirements for training health professionals. So you can see from early on the intent of the Sicily statement was to ensure that there was congruity and integration between preparation of health professionals and professional practice. And these are the 5 steps they came up with. We won't talk through them in detail because I believe you're all familiar with them already. So take a problem, turn it into a question, and flow on from there through the evidence, evaluation of the evidence to develop and evaluate practice requirements. What's interesting about these 5 steps that were really codified in 2005 is that we still lack reliable data on uptake in current healthcare practice today. And maybe that's why you're here. Maybe that's why you're part of gLocal, is because you recognize there's a gap, or you're interested and you'd like to be involved in evidence-based practice and helping increase congruency with contemporary clinical practice. So these 5 these 5 consensus points on EBP were aligned with educational standards, and each requirement was built around the notion of a student experience with a view that the next generation of leaders were already in training and therefore needed to have skills, knowledge, and abilities in the day-to-day operations and decision-making processes of evidence-based practice in order for tomorrow's leaders, if you like, to be those highly competent professionals that we see around us today, that you see in this gLocal event today. And then I guess the question for us is the next generation getting the same level of opportunity in terms of skills, knowledge, and access to tools and resources to embed evidence-based practice into their care? Because in the future, we want to ask them to embed it in their leadership and become the next generation of evidence-based leaders. So these learning outcomes for health professionals are important, even if slightly untapped in terms of healthcare impact and improvement. This group that got together and developed the Sicily statement went on to say something else that's quite interesting, and that's actually what I want to use as my final slide for looking back in time. They said that evidence-based practice requires that decisions about healthcare be based on available, current, valid, relevant evidence, which is great. No one would disagree with that. They also said 3 other interesting things that are on screen for you right now. The decisions should be made by those receiving the care. I wonder how well we do that today in modern healthcare. So patient-centered care or patient-involved decision-making, informed by tacit and explicit knowledge of those providing care. In other words, recognizing the expertise that you bring as a health professional, as a practitioner, when you turn up to work every day, go onto the wards and provide fundamental care for people. and that it had to be within the context of available resources. So I guess my question to you now is, what do you think? How do these three key points work in your practice setting? Do they work in your practice setting? Is there room for improvement? Is there actually a policy framework and standard of care that enables these to be implemented in your practice setting? So if that weren't the case, who would you talk to in terms of improving those kinds of outcomes, those kinds of processes? So let's move forward then. We've had a little look back to 2005, which is ancient history for some of you, a little bit more recent for people with my color hair. But we're going to look forward now for a little while. So this article is actually, it's one paper published in 2021, but it was actually the result of a 3-year programmatic review of the United States nursing workforce. And it used a multi-lensed approach. Was conducted on behalf of the National Academy of Medicine, which you might know of as the Institute of Medicine. This is actually a 500-page document, but I think policymakers should consider reading relevant sections at least, because it speaks to a high-level evaluation of nursing and nursing workforce related issues. What I think is good for us to look at briefly today is what kinds of topics a report of this nature addresses about the profession of nursing. So I'm going to just let the next slide scroll through, but these are the topics that were addressed in this particular report. And it's apologies to colleagues in Wales, but this could be a good test of your Romanian. So there's a number of interesting things in this document, and one of the things that's valuable is that it is a forward-looking document that seeks to evaluate in order to move forward. So they said a number of things that are useful for us to consider, I believe, and I'd want to spend a little bit of time on these. The context of this report is important as well, because context is always important in evidence-based practice. And in this case, we need to be comfortable with the fact that the main lens for this report is social equity. And within the core recommendations, there are some really useful kinds of things to think about. So firstly, the report is unapologetic about the role of nurses in leading improvements in healthcare access and quality, the role of nurses in improving health equity. And if nurses have roles like this, then education needs to be geared to enable development in these fields. So there's also a strong focus on the education of nurses for the future. While it's a 500+ page report, there's some interesting brief things that we can look at, because the recommendations that came out of this report offer some interesting insights into what future nursing workforce could look like. And what I think you'll find is the recommendations that we look at now are going to be very synergistic with the International Council of Nurses and with other peak and professional bodies around the world. So we're just going to look at 3 recommendations in this next part of our presentation together on looking forward. So we're going to look at recommendation 2 first. By 2023, state and federal agencies, healthcare and public organisations, including payers and foundations, should initiate substantive actions to enable the workforce, the nursing workforce, to address social determinants of health and health equity more comprehensively. And my emphasis is in bold here, regardless of practice setting. So this is about nursing leadership. Nursing leadership at the national and regional levels has responsibility to initiate and build a professional case, if you like, to support the emergence of nursing as a professional leadership body. And this should sit alongside, in partnership and parallel with healthcare policymakers and funders. So this is where the voice of nurse leaders need to be at the table in order to communicate the national and strategic value that nurses represent, both at a financial level and in terms of a social equity perspective as well. And both of those can be achieved by looking at social determinants of health and well-being. So that's an important recommendation for us to keep our eye on and consider how we're doing with it. The next one that I wanted to briefly look at was, I don't know how we've gone with this. I think maybe this one's not too bad. By 2021, nursing education programs, employers, leaders, licensing board and organisations should initiate the implementation of structures, systems and evidence-based interventions to promote the welfare of the nursing profession and of nurses individually, particularly as nurses engage increasingly in the work of health equity. So maybe we're doing well, maybe there's room for further development here. There are questions that you can answer that I cannot answer on this. So to what extent in Wales and Romania is there integration or capacity building potential for nurses to drive the improvement and implementation science for structures and systems, for evidence-based interventions to promote advanced practice roles and to build equity? Is that infrastructure in place? And if it is in place, is it delivering appropriately on nurses' abilities to really meet their full professional potential? And the whole basis of these 3 recommendations we're looking at is, of course, around developing the framework. That was recommendation 2. Looking at the practice, that's this recommendation here, recommendation number 3. And then you can probably guess what the 3rd one will be about, because they mirror to some extent the things we looked at in the Sicily statement. And this is about the ability to practice to the full extent of education. So you can now see clearly the alignment between this piece of work on the nursing workforce and the Sicily statement, although they were published 15 years apart. So that's an interesting dimension right there, isn't it, in terms of time differentiation. So what is this saying about practice? Barriers are a safety mechanism, and sometimes we need barriers to preserve value of healthcare. But equally, nurses need the educational structure and system around them in order to fully embrace and operate within the full range of their professional leadership roles. And so there's a little bit of work to do there still. You might be thinking, well, how are others going with that work then? And here's a paper that answers that question. This is from the Lancet on redefining nursing. Again, the consistency is interesting, isn't it? So this is about advancing health equity post-pandemic. But what they concluded was that even health systems within a high GDP context have, although they have the resources, they've generally fallen short due to poor distribution and failure to enhance and protect health, particularly in marginalized communities. So it's fair to say no one's got this right yet. And so that brings us then to gLocal, looking forward. Looking forward, gLocal is an opportunity to showcase the small-scale, rapid cycle change projects that have local impact based on international evidence and therefore global relevance. And that is embedded through JBI training programs that I think you would be reasonably familiar with. The recommendations that have come out of these 2 papers are particularly aligned with the World Health Organization, the International Council of Nursing, and many peak bodies as well. So they're really worth looking at in terms of where we sit today structurally within our own countries, regions, and where the profession of nursing in particular is going as a whole. Where are we at? Where are we going? And am I a part of the process there? Evidence of strong clinical partnerships might be reflected through the conduct and publication of these kinds of high quality evidence implementation studies, all of which are based on essentially the Sicily statement and the nursing workforce paper by the Institute of Medicine. So because we can't achieve these level of outputs and interventions in nursing practice unless we have an evidence-based framework. That framework has to be operable, but it's got to be guided and derived by our education systems. So you can see the congruency that is necessary here. Nursing as a workforce has a significant impact on the world around us. The history, the present, and the future opportunities are tangible, and there's real value for nursing as a practice-based profession to demonstrate impact on things like the WHO Sustainable Development Goals, on contribution to societal issues of equity, diversity, and inclusivity. So how do we bring this all together and wrap this up? From 2005 to 2021, there's significant opportunities for academic and clinical partnerships to begin to embed societal aspects of organisational implementation. And JBI's goal through partnership through the JBIC is to be a contributor there. The question that I want to leave you with is not simply whether JBI gLocal is a showcase of capacity and capability, but whether it's also each time you host a gLocal, the beginning of growth and development and emergence of more nursing impact stories about the future opportunities for nurse leaders to develop and emerge from our undergraduate systems through an integrated way into leadership eventually of policy and practice related to patient health and well-being. So thank you for being with me through this talk, and I hope you truly have a remarkable rest of your session. Thank you.